My name is Eric LaVoy, and I'm a physician at CHRISTUS Trinity Clinic, Family Medicine. I was originally born in Fort Worth, and when I was really young, my parents and my family, we moved to Lake Charles, Louisiana. Spent part of my youth there growing up, and then ultimately we moved to the Phoenix metro area in Arizona. And that's really where I consider my hometown, as that's really where I spent most of my formative years. And it was a great place to grow up. Lots of friends, lots of family actually there too. I have grandparents that are there, got to grow up with them nearby. It was always great to be able to do stuff with them. Probably the biggest influence in my life, I would say, is my grandfather on my mother's side. He actually was a patent attorney and had a hand in a lot of the different things day to day that we take for granted as far as inventions and useful appliances and things that are ubiquitous amongst everybody's homes. For the most part, what he really imparted to me most compared to anything else was really just that love for learning and never stopping learning, and ultimately challenging myself to really figure out who I am and what I want to be in life and where can I take my life to become a better person. Well, for me, I've always been more kind of science-oriented in general, and that exactness and that discovery and that learning that science affords us always stimulated me and kept me interested in what was going on in life. And medicine specifically, I actually remember back when I was little, my parents got me a book of the human body, and even starting just down from at the cellular level, what are we made of? Who are we as physical beings, so to speak, and going from there, just learning more about the human body and what goes right, and when things go wrong, how can we get it fixed? And I really love that, because there's also a little bit of a detective work in a way too. So you have to figure out what are the clues, what are the problems that are presented, and what can you do to fix those. I think for family medicine, probably the thing I love the most is actually that we get to do a little bit of everything. So going into medicine, in medical school, you're trained for everything. And in family medicine, we get to use all of that knowledge, all of that learning, and all that training. It's not a matter of just picking one direction and, to a certain extent, sometimes being stuck with that. We get to use that every single day. And more than anything, that brings me into contact with everybody. Everybody from every background, every single sort of situation you could think of, and come into contact with those people one way or another, and being able to help them is fun, because no 2 days are exactly alike. As a doctor, especially in family medicine, the patient is first. All of the extraneous paperwork and insurance navigation that we have to do is really secondary to me. Yes, we have to know how to do that, and I try to work on that with every patient individually. Everybody's situation is a little different, and we have to jump through some of those hoops as they come along. But really, for me, the patient is the center of my care, my focus. And again, everything is completely different from day to day, and every person's unique situation is going to be different. I could see 10 patients all with the same complaint in one day, and every single one of those I'm going to have 10 different scenarios that I have to figure out and really help a person deal with what's going on for them. And ultimately, for me, again, it's just that patient-centered care and making sure that, aside from everything else, that each person is getting the help that they're looking for.